A1.
I will talk about rhinoplasty for Korean people. I personally say that start the cosmetic surgery with nose and complete with eyes. Rhinoplasty is constituted as very important part in cosmetic surgery. There are some differences between rhinoplasty of Asian and Western people. Due to the different shape of nose, surgical procedure and the purpose of surgery must be set differently. To succeed with the rhinoplasty, ethnicity must be preserved. Therefore, westernized nose shape for the Asian is very unnatural. Natural appearance must be yielded after rhinoplasty. A nose must be balanced with other area on face, and the scar should be remain minimal. Colomelanasi must be formed strong to make beautiful nose shape, which means that nasal tip is the most important in rhinoplasty. And for Korean, tissues better not to be removed but should be saved. Columella suture method is popular for Western people, but this procedure is not important for Korean. Instead, different types of cartilage graft should be applied for a change in nasal tip. Before the rhinoplasty, precise and accurate diagnosis should be done. Nasal skin thickness is the first feature to be diagnosed. If nasal skin is too thick, detailed tip contour is difficult, and swelling tends to last longer. In contrast, if nasal skin is too thin, there's only little room for error, thus any small mistake can be exposed on the skin, so exquisite surgical skill is required. Therefore, it is hard to create slim and beautiful nose with thick nasal skin, and the possibility of side effect increases with thin nasal skin. Rhinoplasty can bring optical illusion effect. If nasal dorsum's high, a face looks smaller, but this is an optical illusion effect. If nasal dorsum is high, eyes become clearer, and forehead, molar, and chin looks relatively low. You are watching two sets of parallel lines, but they don't look like parallel. Like this, face looks smaller as nasal dorsum gets higher is because of an optical illusion like in case B, and bigger looking face due to low nasal dorsum is like in case A. Therefore, you will hear like, "Did you have double eyelid surgery?" or "Did you lose weight?" if the rhinoplasty is properly and accurately performed. Your face will look smaller and eyes will look clearer by optical illusion. Recently, silicone implant grafting is performed a lot to make bulging forehead, but this makes unnatural feature in many cases. Due to the overly protruding forehead, nose looks relatively low. This is another person who had forehead silicone implant. As you can see in the top picture, forehead looks too much protruding, so the implant was removed and the fat injection was performed. The result is very natural as in the bottom picture. The relationship between nose and chin. In rhinoplasty, not only the forehead, but also the relationship with chin is very important. With insufficient projection of chin and depression of subnasal, mouth look protrude. If the degree of mouth protrusion is normal, orthodontic treatment or bimaxillary surgery must be prohibited. After this treatment or surgery, mouth becomes depressed too much, thus making toothless person look, and mouth corners sag as well with shortening of lips, then nose and chin must be corrected. As seen in the picture, this patient used to have protruding mouth, but this becomes normal after the correction of nose and chin. This is the similar case. Rhinoplasty and chin augmentation changes on the shape of mouth as well. This patient had rhinoplasty in the past without chin augmentation. Nose was recorrected with revision rhinoplasty, and small silicone was grafted on chin to make the mouth less protrude and profile contour becomes natural. I already talked about the silicone implants on forehead. Forehead must be considered simultaneously with rhinoplasty. If forehead is bulging, nasal dorsum looks low relatively. In contrast, the person with flat forehead must make the forehead bulging as the rhinoplasty is performed. Otherwise, the forehead will look flatter. Separation of pure fat. As you already seen the forehead silicone implant, silicone makes very unnatural contour. Therefore, fat injection method is used to make proper volume on forehead at A1. This patient had flat forehead with improper chin projection. Our face has a mountain called nose in the middle, and other mountains called forehead, molar, and chin are surrounding the nose. Natural and beautiful contour was achieved after the surgery because the volume of the forehead and nasal dorsum was increased with rhinoplasty. Computer simulation to predict post-operative appearance. Once the consultation and diagnosis about face and nose is finished, change after the surgery can be predicted using computer software. This is a very important pre-operative preparation step to explain the post-operative change of a patient. When you look at the pre-operative view in the picture, this patient had hump nose with insufficient nasal tip projection and superabundant upward rotation, as well as lack of forehead and chin projection are detected. I explained to remove the hump, make the tip projection with downturn a little bit, and increase the volume on forehead and chin by fat injection, as predicted in the simulated picture on the right. Pre-operative examination. As explained so far, after the precise diagnosis of face and nose, nasal cavity examination is processed. Nasal obstruction or any disease must be corrected with rhinoplasty if any of them is detected by examination. This picture is verification of nasal cavity using endoscope. View of nasal cavity using endoscope. Deep part of nasal cavity can be verified using endoscope. Inside of nose looks like a cave, and the width of inner nose is measuring using rhinometry. This is an objective test, and which part of the nose suffers obstruction is verified as well. After the surgery, the accurate surgical procedure is recorded as you see in the picture. If there's any special feature to be bear in mind, it is better to keep it as a record by taking pictures. Types of surgery. Nasal dorsum augmentation. Rhinoplasty can be divided into T-plasty, dorsum augmentation, humpectomy, deviated nose correction, alar resection, and revision rhinoplasty. I will talk about nasal tip surgery and dorsal augmentation. There is a phrase says, if one masters nasal tip surgery, then he masters nose surgery. This means that the nasal tip surgery is very important. In our clinic, open rhinoplasty method is used. The nasal tip is always the problem for Asians, and for nasal tip correction, open method is appropriate. The rhinoplasty begins with harvesting of septal cartilage. Many Korean people have inadequate tip projection and upturned nose, so the tip has to be projected forward and drag the nose downward simultaneously using septal cartilage. Usually, short and low septal cartilage of Koreans affect nasal tip. Therefore, harvesting of septal cartilage and making the original septal cartilage more protrude forward or downward is called septal cartilage graft. The procedure of septal cartilage graft is composed as seen in the picture. Cartilage is harvested from the back side of the septum and moves forward to make it overlapping. This is very important procedure in the nasal tip surgery. When after cartilage graft is finished, nasal tip cartilage is fixed at the normal position of septum. The roundish shape of cartilage in the yellow circle on the left is septal cartilage, and the one in the red circle on the right is ear cartilage. As you can see, septal cartilage is well known as an excellent material for nasal tip surgery because this is hard and flat. Like I said earlier, after septal cartilage graft at the tip cartilage is repositioned. The nasal tip projection is more prominent if the tip cartilage is moved forward, and the nose becomes longer if the tip cartilage is moved downward. In some cases, cartilage graft is performed only at the columella. This method is for septal support without any tip projection. This way of septal cartilage graft makes tip projection as well as subnasal projection. Subnasal part is very important in rhinoplasty of Korean because mouth looks protrude if subnasal is depressed. At the same time, the upper lip gets thicker. Probably this part is the biggest difference between Caucasian and Asian nose. After the nose surgery, subnasal part should be projected in some degree, no matter the person is male or female. The most ideal result is the formation of vertical line. From the preoperative picture on the left, you can see the droopy nasal tip with inadequate tip projection and little bit of dent on subnasal. After the surgery on the right picture, these problems are properly corrected. In some clinics, doctors use silicone for columella support. Look at the picture. You can see the thick septum and nasal fundus droops too much. This type of surgery is called cat surgery, and this should be avoided since the risk of side effects highly increases if foreign substance is inserted at the tip or the columella. As I explained, septal cartilage extension or cartilage graft is finished. One more step can be proceeded, such as cartilage suture or narrowing, but this procedure is comparatively less important in Asian rhinoplasty than Caucasian. If nasal tip projection is inadequate or nose is short even with this procedure, cartilage graft at the tip is performed depending on the case. Also, some doctors graft silicone ball at the tip called pearl surgery. In this case as well, it is rarely effective and the risk of side effects increases due to the silicone. Then I will show you how the shape of nasal tip changes after the surgery through those procedures. Low nasal dorsum with overly upturned nasal tip is the most frequent cases in rhinoplasty who wants nose surgery. The person on the left picture has the upturned nose with inadequate nasal tip projection. In this case, septal cartilage extension, which projects the nasal tip forward and drags downward to make the nose longer, is necessary. This patient only had the nasal tip surgery to correct inadequate tip projection without any problem on the nasal dorsum. By projection of nasal tip, the overall nose shape was improved. This is the view from the front. It may hard to tell the difference in the frontal view with two-dimensional plane. Like this, the result can be well seen in the profile view than the frontal view. In the view from the bottom, except the nostrils in the center, you can see how the nose shape changes as the tip was projected. As the nose is projected forward, the length of columella increases and the shape of nostrils changes as well. This person had blunt tip with inadequate projection. After the surgery, tip looks sharp and projected. This septal cartilage extension graft is not only helpful for lengthening of nasal tip. This is also helpful for those people with long nose, as in the picture, to lift up the nasal tip. This male patient used to have long nose and the tip was projected upward after septal cartilage extension graft. Severely droopy columella can be corrected by septal cartilage extension graft. In contrast, the columella can be dragged down if it is hanging too highly. Like this patient, nostrils are too much exposed when columella is extremely droopy. The nasal tip was projected and columella was lifted up by septal cartilage extension. The change in shape of nasal tip and nostrils can be seen from the profile view. Both severely droopy columella and highly positioned columella can be corrected using this surgical method. This columella in the red circle can be pulled down by septal cartilage graft. The columella of this patient was highly positioned before the operation, and this was repositioned low using septal cartilage graft. Philtrum looks long and the nose looks relatively short if the columella is highly positioned. The contour of columella and nostrils are not seen in the profile view before the surgery, since the columella is situated in the upper part. So, septal cartilage graft was performed to pull the columella downward and contour of nostril is now seen on the side. This is the natural profile shape of nose. It is the last picture of nasal tip surgery case. This patient also had nasal tip surgery using septal cartilage graft. Nasal dorsum surgery is followed by nasal tip surgery. Dorsum is augmented when tip plasty is finished.